And we will start off today with Britt, who's going to share with us a stakeholder introduction. I'll pass it off to you, John.
Good morning. I think I have the most fun part of this. So I get the honor of introducing a new stakeholder, and we'll get started. So why do we do this? Well, to get to know each other, build connections that lead to collaboration, and to have fun. So the first questions we ask is of this person, what do they do to relax or unwind? And this person plays video games with his girlfriend. I guess I can say he now. He builds PCs and he likes to work out. So I think there are a lot of people on the call, myself included, who can relate to a lot of that. Some interesting facts. He picks locks in his spare time. I do that too, actually. And he worked in a local grocery store for many years early on. What do you like best about your job? So he's finishing up his master's in healthcare informatics management. And he's not had a lot of experience with EMS data yet, but he's looking forward to using it to help create some evidence-based treatment plans for their protocol book. How long has he been in EMS? 16 years, from EMT to paramedic, critical care, transportation, urban 911, and he's been a paramedic, an educator, and a systems analyst. So should fit right in. You found your tribe. So any guesses? Welcome to Mr. David Bopp, systems IT analyst with Indianapolis EMS. There's David in the middle, and I think I've got this correct. Correct me if I'm wrong, but that is Milo on the top and Sophie on the bottom. So welcome. We're glad to have you. And that's it for stakeholder introductions.
Sounds good. Thanks, John. And I will go ahead and share the agenda here. And next up, we have an update on our annual meeting, save the date, from Monet. Do you have anything to share, Monet?
Yes,
share your
greetings,
screen.
everyone. John, share your screen for me, please.
Is that?
Okay. We'll actually go to the NHTSA website. Oh, okay. Never mind. There we go. That's the one I'm looking for. Thank you. Everyone, I just would like to invite you to please share the date for the NHTSA annual meeting. The dates are October the 22nd through the 25th. The meeting will be hosted at the Sheraton Park City, which is closer to the Main Street scene. For those who are new to working with NHTSA or who have never attended the annual meeting, the purpose is to provide an amazing opportunity for state and territory data managers, software developers, and the EPCR agencies this year, in addition to the national EMS partners, to meet face-to-face, to have those essential discussions about how to better collaborate on the implementation and utilization of the data standard, and to work with the TAC to support changes in the industry and to move towards greater data interoperability. I want to say thank you to everyone who attended last year and who provided feedback on the evaluation survey. I have reviewed the comments and I'm actively working with the team to structure a meeting and an agenda that reflects your interests and your concerns. While there were an overwhelming amount of positive comments, I also immensely appreciate the honest and direct comments about making the meeting more meaningful and beneficial for those who are required to travel. As we continue to draft the agenda to provide new and meaningful information for all stakeholder groups, please know that we are listening and that our goal is to always improve the annual meeting experience. As a follow-up to a question about CEU credits, I'm happy to say that we can allow participants to earn up to 3 CEU credits per day, potentially for a total of 12 credits during the meeting. The registration site will be available soon, so please stay tuned for more information. Are there any questions at this time? If you would like to ask your question, you can enter it in the chat. If you have a question that comes up at a later time, please feel free to use the submit a help desk ticket button on the NHTSA website. Use the general category for your question, and we will see the question, or you can reach out to me directly if you have any questions or comments or concerns that we should consider for the annual meeting, and we'll be happy to review that information. Thank you so much, everyone. Have a fantastic rest of your day. Okay, back to you, Lauri.
Yeah, thanks, Monet. We do have a question in chat there. Let's see. First, we have a comment from Karen. Thanks so much for the update on the annual meeting. Great news about CEUs. And then Andrea asked, last year, the first day was not vendor required. Do you know which dates require vendor attendance this year?
Yes, Andrea, thank you so much for the question. And I have also seen your comments in the ticket system. As we continue to work on the agenda, we'll make that information available to you as soon as possible regarding which days are required. I don't have the specific dates at this time, but I know one of the things we're trying to do, similar to the state manager forum, we'll also have a forum for EPCR vendors and a forum for the software vendors. So we're continuing to work on that information. And as soon as it's available, we'll make that announcement. We'll have all the information on the website. There is a page right now that's called Software Vendor News, but we'll have all this information actually posted in the hero slider. So you can simply click on that hero slider button or picture, and then all the information will be available there. So thanks again for the question. Let's see.
And I put a link to the annual meeting off of our website in chat as well.
Okay, fantastic. All right, so if you have additional questions or concerns, just submit those to us in a ticket, and that way I can keep track of all that information. Thank you so much. Have a great rest of your day.
Sounds good. Thanks, Monet. And up next, I'd like to introduce Josh Legler, and he's going to give us an update on interoperability. And then he actually has the following note on our agenda as well. So he's going to also discuss national custom element for the Richmond agitation sedation scale for the RASS scale. So I will pass it over to you, Josh.
Okay, thanks, Lauri. I've got a few things to update you all on in regards to EMS interoperability. Multi-year effort here to improve interoperability between EMS and the rest of healthcare. And a few updates for you today, and a few invitations with these updates, some things that, some opportunities for you. So I'm gonna just briefly remind you about the recent training that I did on interoperability back in February. Well, it's still February, earlier this month. The National Database Outcomes Challenge, which I discussed during that public training. And we need some help getting hospital perspectives on the next interoperability task force call, which will be in April. And I will be at the HIMSS conference about 2 weeks from now, and would love to meet with people there. So I did a public training on February 6th for the NHTSA TAC on interoperability. Covered how EMS providers can participate in existing networks to share data, what EMS vendors need to do to implement connections to those networks, how to find resources for implementing interoperability, and quick wins for increasing the amount of outcome data in the national EMS database. This presentation training really turned out to be a good, I think, primer for anyone who needs to kind of catch up on interoperability and understand the path forward for getting EMS connected with the rest of healthcare. So let me see if I can actually grab this link here and get it into the chat. Well, I'll get it in after I turn off my screen share here. That's just a link to the video recording of the training on the NHTSA channel on YouTube. So feel free to visit the NHTSA channel and watch that recording if you missed it and want to catch up on interoperability stuff. During that webinar, I presented what I'm calling the National Database Outcomes Challenge. You've probably seen me share this before, that in the national EMS database, just over 1% of patient care reports have outcomes from the hospital. That's a very low percentage, of course. We'll get the numbers for 2023 probably in the next couple of weeks and see if that number went up at all. But it's a priority of the NHTSA TAC to get outcomes on a greater percentage of patient care reports in the national EMS database. And as I talk with people around the country, I run into quite a few agencies who tell me that they are getting outcomes from the hospital they deliver patients to. And so then I work with them to look in the national EMS database for the data that came from that agency. And so far, in every agency I've looked at, the national database does not have that outcome data that the agency is in fact receiving at the local level. So there's a breakdown somewhere. They're getting outcomes, but those outcomes aren't making it into their export that they send to their state, and therefore not making it from the state to the national database. And we want to fix those gaps where agencies actually are getting outcomes and make sure those outcomes make it into the national database. And so my call is, this is my first invitation, or second, I guess, this morning, is if you are in an agency or you are in an EPCR vendor and you're getting hospital outcome data, please contact me. I'll check the outcome data from your agency or your software in the national database. I'll let you know what the percentage is for you. And if that doesn't match up with what you're seeing on your side with the amount of outcome data that you're getting, then we can work together to fix the gap and figure out where that gap is. I think one of the gaps we've probably identified is that maybe the PCR gets sent to the state as soon as it's finished by the EMS provider. And then the hospital outcome data comes in, a few days or a week later, and it gets incorporated into the EPCR system. But the EPCR system simply doesn't resend the data to the state that would have the outcomes then incorporated into it. So that's a pretty simple gap that can be fixed, I think, pretty easily. So let's work on those, and we can fix that gap. That I can look at your data again in the national database, and we can demonstrate that a change happened and that those outcomes are making it to the national database. So please contact me if you're getting outcomes and want to see if they're making it all the way to the national database. Okay, third thing I have, we've been working hard for over a year now on the EMS Interoperability Task Force, which is met monthly. I've just thrown up here all the topics that we've covered over the past year, a whole bunch of stuff. We're getting down near the end of the topics that we need to cover. We'll be wrapping up in just a few months. But I've highlighted the call that we're going to have on April 11th. And on that call, we're going to be discussing the information that the hospital needs to receive from EMS when they receive a patient from EMS. So we know what all the technical standards are. We know kind of what's possible from a technical perspective, but this topic is actually more from the operational or clinical perspective, asking the question of, well, what does the hospital really need to know in order to take over the care of that patient and provide the best care possible for the patient? So what do they need to know about what EMS found on the scene, about the interventions that EMS did, how the patient responded to those interventions, whatever it might be? What's clinically important and even operationally important to the hospital to get from EMS? In order to answer that question, we really need to hear from people who work in hospitals. And so my third invitation for this morning is that if you have connections with people who work in hospitals, especially those who work with EMS or receive patients from EMS, or if you work in a hospital yourself, please get in touch with me. I'll show you my contact info in just a sec. And I'd love to get some input from you in advance of that April task force call to just kind of collect from you or the people you work with information about what the hospital clinical staff would deem important to receive from EMS as they take over their patient care. The last invitation is to meet me at HIMSS 24. HIMSS is the Healthcare Information Management Systems and Systems Society. It's the big industry organization for all health IT. And so they've got their global conference happening the second week of March in Orlando. I'll be there on behalf of the NHTSA TAC. And so if you will be there, whether you're a software vendor or you work for an EMS agency or a state EMS office or whoever, any of you who are going to be there, I would love to have just a few minutes of one-on-one time with you to talk with you, have some conversations about interoperability, and learn more about what the NHTSA TAC needs to do next to help you with interoperability. So please contact me for any of the above that I've shared, these 4 things, at my email or phone number. Or if you are attending the HIMSS conference, you can contact me directly through the app that HIMSS uses for the conference. Okay, so that's the interoperability update. As soon as in a minute, I'll pop a link into the chat for the training that I did in February. Let me just check. Oh, Chris got it for me. Thank you, Chris. And if there are any questions, feel free to raise your hand or put them in the chat. I'll just take a pause for a sec here before I move to my next topic. Okay, cool. Next topic, just a brief one. There is a new national custom element that's been put out in the national custom element data set. Again, this is national custom elements are completely optional things, but they are an attempt to take situations where multiple states or agencies are wanting to implement a custom element for the same thing. And this gives a quick way to actually implement that element nationally, consistently, so that every agency or state doesn't have to try to figure it out over and over on their own. So the Data Managers Council of NHTSA put together a request to create a custom data element for the Richmond Agitation Sedation Scale, or RASS. You can learn more about that scale if you just Google for it. There's a page on Wikipedia. It's a medical scale used to measure agitation or sedation level of a person. And it's a simple ordinal scale, a +4 down to 0, down to -5 for the level of agitation or sedation of the patient. So if anyone is needing to track that information, then you can find that new custom element configuration in the national custom elements. I'll just mention that we also dropped 2 custom elements, and those were the extensions that we had done to e-injury.03 and 04, the trauma triage criteria, to implement the new ACS criteria. Those are now standardized in the NHTSA standard as of the critical patch that was released last March. So we no longer need custom element configurations for those in NHTSA version 5. So those were dropped from the national custom elements. Okay, any questions for me on that custom element? Okay, thanks, Lauri.
Sounds good. Thanks, Josh. And next up, we have Ben Fisher, who's going to chat with us about 3.5.0 values being added to the cube.
Yep. I will really quickly just share the screen from the cube real quick. So there will be a mix of 3.5 and 3.4 values in the data cube for a little bit as we transition from 3.4 to 3.5. So this is just an example for type of service requested. You'll see a couple of the older 3.4 values as well as some of the 3.5 values, and then similarly for the disposition values. So I will also just say that you would anticipate these to change by year. So if you look by year, you'll start to see the transition in elements from the 3.4 elements to the 3.5 elements. We are working on a longer term solution to kind of map these from 3.4 to 3.5, but right now you'll see both. That's kind of the really brief update. And I will just say that we are working through a production maintenance issue right now that means that the cube did not get updated this week, but it should be back to its normal update and refresh schedule next week. And I'm happy to answer any questions about that.
And I believe, Ben, there's several dashboards affected by that maintenance update. Is that right as well?
Yeah, a big chunk of the version 3 dashboards are affected by that and won't be refreshed this week. And if for any reason that extends into next week, we'll send another email out to the Google list.
Yeah, so if you're looking at dashboards, if something looks off, it's likely due to that maintenance window. Any questions for Ben?
All right. Thanks, Lauri.
All right, sounds good. Thanks, Ben. Next up, we have Clay Mann, who's going to talk about a call for UUID pilot projects.
All right. Thank you, everyone. It's great to meet with you this morning. I want to talk to you about an opportunity that we are working with the CDC on. As folks may or may not know, the CDC was awarded some funds basically after COVID, their bill funds, the bipartisan infrastructure law funds, to develop a more robust injury registry from that extends across all types of injuries across the U.S. It's called the NSSP, and as they extend this and try to include the entire healthcare event for any injured patient here in the country, they're interested in including EMS data. So it's a unique opportunity for us to work with them and see how the EMS data associated with a hospital, a visit for an injury, how that could be implemented and incorporated into the NSSP. So there is a call. I'll just share for you some draft notes that we've been working on with the CDC. They are interested in utilizing the NEMSIS UUID to and moving that into a hospital EHR, electronic health record, so that they could pick up that UUID and incorporate it with some ED data that would be collected when injured patients enter the hospital. So it's a unique opportunity for us to continue to expand the use of the NEMSIS UUID and kind of deal with interoperability of the standard utilizing that code. So as folks probably know, we've built a good use case, have lots of resources associated with working with hospital trauma registries to ensure the EMS UUID could move across into a hospital trauma registry. This CDC effort is interested, right now they're interested in being able to speak with you as a state or as a vendor who may have some interest here in kind of coming up with some use cases that would be valuable, practical ways to be able to have the NEMSIS UUID move into the EHR within a hospital and then be picked up in the NSSP. So right now they're calling for ideas for potential mechanisms that people can see to make this happen. I mean, one way to think about this, I mean, a simple use case would be, well, for systems that have implemented the UUID into the hospital trauma registry, if that trauma registry is incorporated into the EHR system, then it could move from the trauma registry over into the EHR, would be an example, right, of how that data could end up in a patient's EHR if they're admitted to the hospital. So clearly there's lots of potential here, right? We're hoping that the NEMSIS UUID can be picked up by police data reporting, by FARS fatal accident reporting systems, utilizing MUC, utilizing CARES. So again, there's just really great opportunities to kind of expand the use of the NEMSIS UUID. So this request is for us to work with you and see if you may have some ideas within your states or within your agencies or within your customer base as a vendor product. Is there like working systems that are sharing the UUID, or is there strong interest in being able to expand the use of the NHTSA UUID in areas where you work? We'd love to hear from you about that. And we'll connect you with the folks at the CDC that are working on this. And we will also work with you to see if we can develop some type of a use case where this could work. And then hopefully that would be incorporated into some funding opportunities for some pilot projects. So I'll stop there and see if there's any questions. We mentioned this on the DMC call with the states, the data managers call from the SEMSO, and there were some states that showed some interest. We'll be reaching out to you. Would love to hear from you again if you'd like to discuss any ideas. But I'll just open it up if there's any questions about this upcoming opportunity with the Centers for Disease Control. All right, well, thank you. If you have any questions or have interest, please drop a note in the chat and we will meet with you and discuss the possibilities. Thank you.
Sounds good. Thanks, Clay. And feel free to put a note in chat if that's something you're interested in and would like to be included in future communication or would like some more information. Next up, we have Eric Chaney, and he's going to discuss any items from the Office of EMS and NHTSA.
Hi, good afternoon, everyone. I have no specific, well, I do have one, always money. Basically, if you are still working on any of the NHTSA grants and you're looking for more support or assistance, please let us know. I've had another one of the EPCR vendors reach out, and we're going to be doing some work with them here. I believe it's tomorrow to talk about how they can help their customers get specific grant money for various things in the NHTSA world. So there's a lot of people out there that are willing to help you put these things together. Again, these are not huge, heavy lift grant topics or grant proposals like you would expect to see in the federal government sometimes. A lot of these are pretty straightforward. It's just a matter of doing a little bit of legwork and getting to know some of the people in the process. And it sounds like they're willing to help do that. So more to follow on that after tomorrow's meeting, but if you need assistance, please reach out. Does anyone have any questions, comments, or concerns for me? I'll chat here real quick. Well, if you have something that comes up, please, by all means, reach out. I think most of you have my cell phone number, or all of you have my email address. Please drop me a line and I'll get back with you right away. Thank you all.
Sounds good. Thanks, Eric. And next up, we just have an announcement about our upcoming public training on Tuesday, March 12th. The topic for this monthly training is compliance and what is a software company tested on. And so Jen Correa is going to lead that training if that's of interest of you. We invite you to join us, or if you're not able, you can always look for the video that's recorded afterwards and watch that as well. And next on our agenda is open forum. Does anyone have any questions or topics that you'd like to bring up or discuss together today? Feel free to put a note in chat or raise your hand. We had a question, is there a standing meeting invite for the public training? Chris, is that a standard invite or does a unique Zoom link get sent each time?
It's the same Zoom link that we use for here, and we send out a calendar invite with the notification.
Okay, so be looking for that notification to come in an email. Any other questions? All right, if not, then our next meeting is scheduled for March 13th at 11 a.m. Mountain Time. We hope you can join us again then, and we want to say Thank you for joining us today. Thank you for your participation, and we appreciate your time. We know you all are busy, and we appreciate you making this a priority. Reach out if you have questions. You can always submit a help desk ticket if you'd like more information on anything we discussed today, or reach out to anyone at the TAC, and we'd be happy to help. Thank you all.